So Evan, I'm going to say something and turn it over to you. Okay. Good morning, everybody. We are going to go ahead and get this joint committee session started. Our colleague, Councilmember Hans Reamer, chair of the PHED committee, will be here momentarily. But we want to try and stay as on schedule as possible. This is obviously a critically important discussion and appreciate everybody's hard work, and we look forward to seeing the presentation. I want to now turn it over to my colleague and friend, Councilmember Evan Glass, who is our lead on homeless issues and for vulnerable populations. Councilmember Glass.
Thank you, Mr. Chair. Good to be here this morning. The first half of today's conversation is going to be on ICH and the 3-year plan, and I'll make my comments brief and say that as the Council's representative on ICH, been working with that organization over the last year to update its governing structure. And so I'll share with you that later this month, the HHS committee, the 3 members, Chair Albornoz, Councilmember Rice, and myself, will be introducing legislation as a whole to update ICH so that we can continue providing those good services and expand the services for the next point of that mission. And what that mission is, we will now hear. So with that, I'll turn it over to Ms. McMillan or anybody else who wants to come up to the dais.
We have Dr. Kroll and Amanda Harris and Sharon London here today to present to you about the strategic plan. I did just want to say we wanted to get this to you prior to budget discussions, both capital and operating, because everybody wants to make sure that the budget is moving in sync with what the adopted strategies are, and that way we also will be able to measure our outcomes to see whether our investments are having the results that we want in terms of our efforts to reduce homelessness. And with that, I'll turn it over for the presentation.
Good morning. I'm Dr. Raymond Kroll, the Director of the Department of Health and Human Services. Good to see you all again this morning, especially with some good news. My remarks are going to be very brief, and then I'm going to turn this over to Amanda Harris, our Chief of Services to End and Prevent Homelessness, and to Sharon London, who is a valued member and longtime partner in this fight to end homelessness in Montgomery County. You know from history that our goal is to make homelessness a rare, brief, and one-time only event in anyone's life. And I have to say that our direction towards ending homelessness in the county has been going in the right direction for the last decade or so. And I think we're now poised with the adoption of the Interagency Commission on Homelessness plan to end homelessness by 2023 to really make a final dent, a final push and a final dent in ending homelessness. This plan is the product, I think, of a solid and long-term partnership between providers, the county government, and people who have lived experience, who brought that experience to the table to help us craft a plan that is workable. It draws on best practices nationally, and the work has contributed to Montgomery County's recognition as a model across the country for other communities who are trying to end homelessness. Our goal is to end homelessness by 2023. It's bold, but I think not impossible. And with that, I'm going to turn this over to Amanda Harris. Thank you.
Great. For the record, Amanda Harris. I'm the Chief of Services to End and Prevent Homelessness with the Department of Health and Human Services. And thank you for those words. You did a great job setting the stage. Now I can skip like 4 of my slides, so we'll go fast. So let's go ahead and get started. Before we talk about our plan, I did want to give a little more information about what homelessness looks like nationwide. You can see that over 500,000 people on any given night, on a single night in 2018, were experiencing homelessness. So the numbers for 2019 have been reported, but the report won't come out probably for another few months. HUD is always about a year behind. You can see the breakdown of what it looks like. It's primarily single adults who is experiencing homelessness. And then between 2017 and 2018, there was a slight increase in homelessness, but just less than a percentage point. And since 2007, there's been a 15% decrease in homelessness. Due to coordinated efforts of local government and the community collaborative Built for Zero, which Montgomery County is a part of, there have been significant decreases in certain subpopulations nationwide. So for veteran homelessness has been reduced by 38% since 2007. Families with children have seen a 23% decrease, and chronic homelessness has seen a 19% decrease, which is good and very encouraging. However, the number is staying relatively flat nationwide. 67% of people experiencing homelessness can be found in just 10 states, and those are largely the most populous states. So New York, Hawaii, Oregon, California, and the District of Columbia top the list. And these, not coincidentally, are places that have the highest housing cost in the nation. So a lack of affordable housing clearly leads to homelessness. In 2017, 6.7 million households spent more than 50% of their income on rent. And 4.4 million people in poor households were doubled up or staying with family and friends. So the problem is huge. I am encouraged to hear some of the presidential candidates actually talking about homelessness. That's the first time I've ever seen that, and since I've been paying attention to politics. So I think that there is much more emphasis on solving this, and we do have solutions. We just have to be willing to invest. Okay, thank you. So now a little bit about what it looks like here in Montgomery County. So here's just a comparison, year-to-year comparison. Since 2009, we've seen a 46% decrease in homelessness. Okay. Here's just the breakdown. Again, not like much like the national statistics. Most of the people experiencing homelessness are single adults, and that's non-chronic single adults. 40% of, well, can we go to the next slide, please? This is about age. I think age is a really important factor that we need to consider. So 40% of all single adults are over age 55 that are experiencing homelessness. 62% are over age 45, and 14% are over age 62. We have had people as old as 81 in our homeless shelter. That to me is not okay. We certainly need to be doing something about it. And I highlight the people that are 45 and above, even though 45 might not seem that old to many of us. We know that people experiencing homelessness have a life expectancy that's 30 years less than the average American. So that at 45, they're really, their body and their health is more like that of a 75-year-old. Okay. Here you can see, this is from our 2019 point in time, and just looking at certain subpopulations, you'll notice that there have been decreases in almost every subpopulation, with the exception of people experiencing reporting a physical disability. That increased by 44%. I suspect, I don't know this for sure, that that has a lot to do with the number of people that are aging. Okay, this is, I'm just trying to illustrate here what is the scope of the issue. So this is looking at the scope of homelessness compared to people with service and housing needs. So that first bar, that's all the people that are receiving any kind of services from the Department of Health and Human Services. So that's 110,000 people are receiving our services. Those that are rent burdened, that's over 60,000 people in Montgomery County are rent burdened. Those receiving any services from our service area, services to end and prevent homelessness, 15,000. Then those who received SEF services who got prevention, so eviction prevention, it was 12,000. But the people experiencing homelessness is just under 2,000 annually. So I bring this up just to highlight that although there are a lot of people that are in need and could certainly benefit from our services, they're not ending up homeless. People are incredibly resilient. They have figured it out. It would be lovely if we could provide all 60,000 of those people a housing subsidy, but we're not going to be able to do that anytime soon. So we need to make sure that we're targeting our resources in the best way, so that 2,000 people, we can address their needs and have that be more like 10 people or 20 people. Okay. So now for the plan. You can go ahead to the next one. Whoops. This is just an explanation of how we got there. This has been a year-long process. It's just a timeline. We started in February of 2019, and then we had our launch event in January of this year during the one day this winter that it snowed. So thank you, council members who showed up and braved the cold. And I'm from Michigan, so it didn't seem like much of a feat to me, but thank you for coming. That's just highlighting. So go on to the next slide, please. We've already talked about this, but this was not just an HHS effort. This really involved multiple players. We had provider focus groups, so we reached out to folks that were serving on the front line, doing this work, getting their feedback, people with lived experience. We had a number of action planning working groups, which many of the council staff participated in, and then we had a community-wide meeting. Yes, next slide. Other information that was used to develop the plan, obviously our point in time, other HMIS data, so Homeless Management Information System data, so data about our work, looking at national best and promising practices. And then we also referenced our 2017 gap analysis that really helped us identify what are the needs in the county. So that was around scaling rapid rehousing, refining our diversion and prevention, expanding Housing First permanent supportive housing, expanding the rental assistance program, and expanding the housing initiative program. We have done some of these things, but we haven't done all of them. Here, it just lists the members of our strategy and planning committee, which is why Sharon London is here as one of the chairs of the committee. Unfortunately, Fred Swan, who is the other chair, was not able to be here today. Lots of people participated. We've talked about this. Just special shout out to everyone that helped us with this important document. All right, so now for the plan. What is it? Go ahead. Yes, so you can read, but here's our vision. As we mentioned before, our goal is to have homelessness a rare, brief, and one-time only experience. We really also wanted to make sure that we were highlighting the collaboration and the commitment, and that we strive to be a leader. So we don't want to just end homelessness in Montgomery County. We want to be a model for other communities. We believe that we can end homelessness in this country, and we want to be at the forefront of that. Our bold goals. We've done some of these, still have some work to do. Veteran homelessness by 2015, chronic homelessness by 2019, families with children by the end of 2020, so very close. Children or unaccompanied youth, so this is children ages 16 to 24 without an adult by the end of 2021. Seniors by the end of 2022, and then everyone by the end of 2023. The one thing I will highlight from this plan that's different from years past is seniors. We added seniors because we are seeing that growing number of the aging population that we wanted to specifically spell that out. To my knowledge, I don't know of any other community that has laid out seniors as a subpopulation to focus on.
And just to highlight, you get prioritized in the highest priority category. So, and this is important, especially I think on the seniors. So it was important to highlight seniors, but if a senior is a veteran, then they will go, if they're eligible, they might be served through the veteran category. So if a VASH voucher is available, so you get prioritized in different categories. It's not necessarily waiting for, just waiting for one or the other. Everybody's prioritized.
Correct, because we know that people fit into multiple categories. We're all complex, so yes, that's correct. Okay, so I wanted to give you an update on where we're at with some of our initiatives, and then we'll go deeper into the plan. So this is on veteran homelessness. This is what's called a run chart. We're part of the Built for Zero community collaborative, and we need to report our data, so there's some accountability. And this is looking at every month how many veterans were experiencing homelessness in our community. And our functional zero number is 6, and as you can see from the chart, although we've gone up, we've been able to come back down and stay pretty steady around 6. This is our chronic run chart, the inside, not outside, ending chronic homelessness. When we first started reporting, we had 274 people identified. As of today, I believe we have 10 people on our list identified as chronic. You can also see that for the last year and a half, almost 2 years, we've been staying steady around 11 people. Although we haven't met the federal benchmark of functional zero, which is 3, we feel pretty confident that we've done what we needed to do. This is looking at families with children. So I thought I'd show you this information in a slightly different way. There is no, right now, there's no federal benchmarks for ending family homelessness. It is largely about, does your inflow match your outflow? How long are families experiencing homelessness? These are the things that we're looking at. So here, right now, as of today, we have 57 families that are experiencing homelessness. Every month, we have an average of 15 new families becoming homeless. And then every month, we're able to house 17. So that's good. We're housing more than are coming in. So our monthly reduction is 2. So that means if we continue on this pace, we'll be able to reach functional zero. We'll be able to, our inflow will match our outflow in 28 months. So that's a little slow. That's, we're supposed to end family homelessness by the end of 2020. So we're hoping that with some additional resources like rapid rehousing, we'll be able to increase the outflow, the number of families that we're housing, so we can get to that number sooner. This is looking at the length of time, so how long are families experiencing homelessness? With this data, I will point out that we are only looking at a half a year. So this is July to December, because I wanted to include the FY20 numbers, but we're not through the year yet. But you can see we're going down, significantly down from 2017, but we're trending in the right direction. And this is the percent of exits to permanent housing. So we don't want to be in such a rush to get people out that we don't care where they go. So we want to make sure that families are connecting to permanent housing. Again, this is from July to December each year, and you can see the number is going up. We're at 62% right now. Excuse me. Okay, so what would happen if we just continued status quo? It wouldn't be good. That's the short answer. So this is for looking at single adults only. I think even with the families, if we continue at status quo, we'll get there. It'll just take a lot longer. But with single adults, we are not moving near fast enough. So you'll see our monthly inflow is 60 people. Every month, 60 people enter our homeless continuum. And each month, we're able to house 23. So that's a monthly addition of 37. And those new people, that includes 56 that are new to the system, and then 4 that are returning to the system. And then on the other side, 17 that are housed and 6 that are other exits, which could mean, unfortunately, that they pass away or that they're placed in a long-term institution. Those are the other kinds of exits. So looking at this, if we continue as is, by 2020, the end of 2023, which is our goal for ending homelessness, we will have an estimated 2,100 people experiencing homelessness, which is more than we have right now. So more than double. So right now, the current active number is 400. It's in the middle. I know there's a lot of information on that graphic, but right now it's 400. So it's growing exponentially. If we don't, because we can't match the inflow. So what we'll talk about in the plan is some of our strategies to address that. It's not all about increasing the number of people that we're housing. That's part of it. But we also have to do something on the front end. We have to figure out a way to reduce the monthly inflow. So are there ways that we can prevent people from coming into the system altogether?
And that'll be the second part of this conversation today.
Yes. Yes. Okay, so looking at our values, we thought that it was important to not just have strategies, but that we made sure that we're talking about why we're doing this and what's important. I won't talk about all of them, but I do want to just highlight a few things. Housing first is essential to ending homelessness. Any of the communities that have ended veteran homelessness or chronic homelessness have used a housing first approach. And we know recently there has been some increased criticism of the housing first approach and from some of our federal partners. And we just want to make sure that we continue to do what we know works and what's best for people. The other thing I wanted to highlight is around the diversity, equity, and inclusion. You'll see in the plan that we called out racial disparities specifically due to the magnitude of the problem. But that's not to say that we don't recognize that there are other minority groups that are also a focus of our work. So for example, we know that nationally, 40% of youth experiencing homelessness identify as LGBTQ+. And all LGBTQ plus community members are more likely to be unsheltered because the shelter situation is not always conducive for them. So we put this as one of our values so that it is not forgotten, that we want to make sure that everyone has a place where they can feel safe and comfortable. And then collaboration, we believe in shared decision making and transparency. Data is the most objective way to make tough decisions, and if we want to end homelessness, we have to make tough decisions. We have to use our money in the smartest way. And then change, this idea of continuous change and improvement. We have some ideas based on best and promising practices of what's going to work, but we have to be able to be adaptable. If we try something and it doesn't work, then we need to reassess and do something different. You can skip that one. It's just an overview of the strategies. So I'm going to talk about a few of the strategies, and then I'm going to hand it over to Sharon, and we'll kind of do some back and forth as we go through these. Strategy 1 is around addressing the racial disparities in our system. Many of the reasons for racial disparities in the homeless system, especially for Black people, are about decades of housing discrimination that have led to poor educational health outcomes and lower rates of wealth and assets. So there are lots of other contributing factors, structural racism, for example, that lead to more Black people experiencing homelessness than their white counterparts. And that's an issue, and we want to be able to address it. Our plan here is to advocate for changes in other systems, like in the justice system and in the housing world, but we want to focus on what we can change. So our first step is to make sure that even though Black people are overrepresented in the homeless continuum, are we serving them at the right rate? So are they receiving services proportionate to how they are represented in the homeless continuum? Right now, we know that in our permanent supportive housing and in our prevention world, we are not serving Black households at quite the right rate. So Black people represent 64% of the homeless continuum, and they're receiving permanent supportive housing around 55%, and same on the prevention side. They're receiving it at 55%. So it's not terrible, but it's not as good as we would like it to be. We'd like it to be proportionate. The other thing that we have seen is that Black households it takes them longer to get placed into housing, so slightly longer to get into housing. So that's another core component of our strategy here, is how do we shrink in that time? How do we get people connected to housing faster? And a lot of that has to do with the barriers to accessing housing. We know that people of color, especially Black people, are overrepresented in the justice system, so they're often coming out with a criminal record, which makes them oftentimes automatically denied for certain housing programs. So that's something that we're looking at addressing. How do we figure that out? How do we help landlords feel more comfortable serving this population and not have this be something that stays with them forever? Yes, that's good. This is just a graphic showing how the disproportionate rates of Blacks in the homeless continuum, even when you account for poverty. So 38% of Black households are at 50% of the poverty level, but they're still at 64% in the homeless continuum. And even if you're looking at rent burdened, 30% of Black households are rent burdened, but 64% are entering the homeless continuum. Okay. I could pause for a minute. No. Yeah, I guess I'll pause for a minute after this strategy and see if there's any questions.
Questions? Councilmember Jawando.
Thank you, and thank you, Amanda. Thank you, Dr. Crowell. Thank you guys for being here. Ambitious goals. We like ambitious goals. I like ambitious goals overall. And I love the frame that we want to be a leader nationally for this work, like we already are, but even more. I think that's exactly where we need to be, and so kudos to you on that. I guess I'll start with I have a couple questions, but I'll start where you just ended.
Okay. On
the racial disparities, and I appreciate, Pam Luckett from my staff has been a part of the group, and I know you guys are pulling that together. The last slide, if we could go back one, Linda, is staggering to me. There's a lot of staggering slides and information within this racial disparity question. The fact that there are more white residents at our higher level of poverty at 50% than black residents, which I think most people probably wouldn't assume. Mm-hmm. But despite that, blacks still represent 64% of the homeless population in Montgomery County, even though they're 19% of the population overall. And so that's a significant challenge. You mentioned some of the reasons, obviously, legacy of racial discrimination. I wanted to ask, I had heard some statistics, and I don't know if you have them, about black families and the rates, the period of time. You mentioned acquiring housing, but I had heard some statistics related to black families are more likely to fall in and experience a spat of homelessness here in Montgomery County. Is that correct?
That is correct.
Okay.
Yes. For families, the rate is even higher than 64%. I don't have it on me, but I know that it is higher than 64%.
And obviously so embedded in your goal of ending family homelessness, that would obviously, the racial disparity piece will need to be a big problem.
Yeah.
Because I've met with several families that are working really hard, have kids, and then fall into home. And the fact that that's such a higher rate is really troubling. The other suggestion around this I was going to make was, I know it's a strategy, but I think this is such a disparity that we might consider making it a goal. And I know it might be semantic, but I think moving it up a rung of ending these types of disparities, I think should be a goal and should be another way we're modeling for the country. So I just give you that as a suggestion, as opposed to it just being a strategy. You cite lack of affordable housing, rightfully so, as a really important issue. One of the questions I wanted to ask on this, do we have an early warning system of sorts, or is there a possibility of implementing something like that with landlords, for example, where we're getting information, have to be a data sharing agreement or something, but I just think the more, particularly in this context, but all people experiencing homelessness, the sooner we can find out, as you know, the more we might be able to feed them into the system. Does anything like that exist, or have you tried anything like that?
Nothing formal exists. We have a very good relationship with the Sheriff's Office, so we're in constant communication. I think it's something that we've talked a lot about. We haven't figured out exactly how to do that. I do think early interventions are good. We just have to be clear about what those interventions are, because if you remember, there are a lot of people that are rent burdened, but they don't become homeless. So figuring out what's that happy medium where we are intervening, and maybe that intervention is something different, like maybe it's financial counseling, or it's some low cost intervention rather than a monetary intervention. But it is something that we're looking at. I also know that statewide there is an effort being made to look at eviction rates and how, if there are disparities in who is getting evicted. I know when we've asked locally for that data, we don't have it. It's not being collected.
So the race or ethnicity or geography, none of the data on where?
Geography, yes, we have zip codes.
Okay.
But that's the only information that we have. So I think that's also part of it. Are people of color being evicted at higher rates? Because then we would have a different kind of strategy. We could move that work more upstream.
I think the early warning system would help for anybody potentially, regardless of race. But you mentioned the rent burden, 4.4, and you also mentioned the 4.4 million nationally, is my last question, that are doubled up, living in, together because they're rent burdened. Do we have that number for Montgomery County?
No.
And where are you pulling that 4.4 million number?
So that's coming from the National Alliance to End Homelessness
Okay.
and their report on the state of homelessness.
Okay. I figured
Yeah.
it would be hard to track that, obviously. But,
yes. So it's
but we know it's
probably
happening.
more than that,
Yeah.
but that's what we know.
Okay. And then the last thing I'll say, again, bold goals. I want to challenge the premise you made that, and while I think it's the right goal to end that 2,000 that are experiencing, to end the number that could be experiencing homelessness, I do think there is value, and this is why I come back to this early warning, in going more upstream. Mm-hmm. As costs continue to rise, as we realize that there are these disparities within multiple populations, as people are rent burdened, figuring out a continuum and having interventions in each point, I think will be very important to the ultimate goal, but also is embedded in the work that you're doing. While we don't want people to end up on the street, we also don't want people struggling and being burdened the way they are too. So I just would say I think we can try to do both, realizing we have a small pot of money, hopefully expanding, but just wanted to mention that. So thank you.
That's great, and we will get to that in strategy too.
Good.
Councilmember Rice.
Well, thank you very much, and I apologize for being late, but I seem to have come at exactly the right time. This is certainly something that we've been working on for years in terms of our conversations, especially when it comes to families experiencing homelessness. I did want to touch on the racial disparity piece of that because it's interesting as Councilmember Glass, Director Kroll, and I were out. The people who we encountered, every single one of them was a person of color. And so it directly ties to the findings that we have here. I mean, it is one that is striking in the sense that as we talk about affordable housing, the reality is that we're still not doing as good of a job as we could be. And I think part of that reason, and I see Director Spann here from HOC, the reality is that we need to be doing twice what we're doing when it comes to the HIF and ensuring that HOC continues to partner with developers to create more affordable housing. That's one of the key tenets. But I think, Amanda, that you touched on something that's incredibly important too. When I was talking to advocates, it's about financial literacy. And it really is something that we're going to have to be very serious about because there are people who are teetering on the line. And the difference is, and the reason why, Councilmember Jawando, what I've seen over the years in looking at this, the difference is that their white counterparts are the ones who actually avail themselves of the services earlier and then have the intervention. In my conversations with the sheriff, it's never about, everybody does the outreach, but unfortunately our persons of color, for whatever reason, just don't avail themselves of the services that are out there until it's too late. And I know, Ms. McMillan, we've been looking at this for a long time in terms of, but I think that's one of the things, if we're going to do something different, that we really need to focus on as a strategy is coming up with a way in which we can have that intervention and create that financial literacy, because it happens not only in just our standard renters, but it also happens within HOC. And I know HOC has its own program that's involved that does that, and still folks are waiting until the very last minute. We've handheld people through the process who wait until they're in arrears for $5,000 to PEPCO. And the reality is we could have helped them to get out of that a long time ago, and half of that is like interest and other sort of things. And PEPCO may waive it, but you're still behind at that point $2,500. And those are the kinds of things that we see oftentimes that unfortunately we don't do a good job enough of in the school system, educating kids to bring them up to be that way. And now we've started with our Junior Achievement Finance Park, but I really want to highlight that part of it because there are all the other things we're doing and are out there. We've got mental health out there. We've got other kinds of things. We do need to do better when it comes to workforce development. But look, we passed a, new minimum wage standard, and, just as we said, all those things are good, but they're not the panacea, and even all of them together still aren't enough. We've got to change the paradigm when it comes to folks being able to manage their money effectively so that they don't get themselves in this situation. right? And so I think from that perspective, my hope is that we can really start to hone in on those kinds of things, especially when it comes to families. Because I'll close with this. The young woman that we saw that was living in her car, who was fully employed as a nurse, who has children, who's living in a car less than 2 blocks from here. That's what this is about, right? And how do we take that person from just that line of being gainfully employed, not having her children anymore, bringing that family back together and getting them stable housing and getting her back on her feet? There are a couple things that we need to do that are very small. That's why that racial disparity exists, because we're just not there in terms of getting us over that hump. I feel as though if we can get that part done, we'll start to see those numbers start to level out and things will be a little bit more equal. So I really thank you for your work. I think that there's a little bit more that we need to do in terms of focusing on some of the things we haven't talked a lot about that will help us to get there. So I thank you.
Councilmember Albornoz.
Thank you. So as I've said this before, I really enjoy joint committee sessions because it does give you sort of a more holistic approach at addressing these issues. And I just want to make a couple of comments and then a suggestion moving forward. So I've been very impressed with the system building approach to addressing this issue. I think we've done a good job of bringing together the incredibly important partner organizations to be part of this discussion, because this is obviously a complex issue that spans across numerous agencies and incredible community-based organizations, as well as sister county agencies focusing on housing as well. So, and obviously that's going to need to continue for us to be able to address the next phase of this. But going back even further, I had the opportunity, along with Ms. Harris, to attend the Council of Government session recently on the regional approach to this issue. And it is a challenge because there's only so much we can control. And Councilmember Glass attended that session as well, and I really want to give him credit because he has done extensive follow-up with our local jurisdictions around this issue. And in fact, we're going to be taking some tours soon over some best practices in both Northern Virginia and the District of Columbia. But I was struck at the different approaches that local jurisdictions are taking. And some of our colleagues in Northern Virginia acknowledged that they're significantly further behind than we are as a community. And neighborhood by neighborhood varies greatly in their approach to this issue. So I think the regional aspect of this is going to be important. And I do think, as a follow-up to this discussion, we had discussed in COG about doing a joint session, but also as a hook, talking about the incredible cuts that have been made at the federal level that are going to have a cascading effect on this work. And so I think as a follow-up to this discussion, there'd be value, maybe after the budget process is over and things settle down a little bit, for us to collectively go before COG and bring our federal partners to have this discussion. So I think that'd be important. And here's my suggestion. One of the ways that we've holistically tackled from a budget perspective other emerging issues and opportunities like our aging population, youth development, I've observed after this first year, the budget process is overwhelming, and we only have so much time to process all of this information. When we're talking about system building approach like this, and you've got the budgets of nonprofit partners like MCCH, who's here in the audience, and other incredibly important organizations. As we're talking about family homelessness, the Family Justice Center is also very relevant to this discussion. It'd be helpful to have the information in one place for us to be able to analyze from a budget perspective what the situation is within those various organizations, as we've done in the past through a clustered budget approach in other areas. Which I really enjoyed. And so I think, Ms. McMillan, as we look at the development of the budget process, if it would be possible for us to cluster some of the work specifically addressing homeless issues to give us a better view and perspective so that we don't miss anything or minimize the risk of missing something, I think that'd be helpful. And that extends to our nonprofit grants and contracts as well, in addition to the budget more generally of the Department of Health and Human Services. So those are just some suggestions and comments for now, but I don't know if anybody has any reaction to that, but appreciate the conversation.
I'll turn it over to Chairman Reamer.
Thank you very much, Councilmember Glass. I just wanted to make a quick observation as we continue through this conversation about our rate of housing production. I was struck by the numbers that you cited about those communities that have the worst homelessness challenges are typically communities that have the worst housing markets, from the human perspective of how easy is it to get housing. And we seem to be heading in that direction. We're not the West Coast yet, but our housing production is now significantly lower than what it used to be, 10 years ago. And that is a real problem. If this is a trend that just continues and continues year after year, I think we're already experiencing the negative consequences, but, 10 years from now, it'll be far, far worse. So we have to include in our thinking about homelessness a general understanding that we need bigger changes to unleash the housing market or create a healthy housing market. And the HIF is a piece of that, but that is the financing that you are providing for dedicated, affordable housing typically. And that is a component of the overall housing market. And when you're not creating enough new housing, then people are it's not like the people are crowding into the housing, and it's not being shared widely enough. It's hard to explain such a simple concept as you need to create more housing as your population grows. Our population is growing faster than our housing supply. That's going to create problems. So we just have to keep that in our minds and understand that when we are taking up master plans, when we are taking up regulatory issues, that we should always have a mind to how will this help loosen the market and allow for more investment. It's a complex challenge, but I just want to keep that in the conversation as we continue.
Thank you for that. I'll just add at this point that Dr. Kroll, you started the conversation by saying that this proposal is bold but not impossible. That's how I like my public policy, quite frankly. And so that is a good way to frame it. And the approach that has been taken here over the last 2 years, quite frankly, has been a very collaborative one with all of the nonprofit providers, all the service providers, many of whom are here. So thank you for that engagement. Thank you for everything that you do on a daily basis. And the one question I have before I let you finish the presentation is, Ms. Harris, you talked about the seniors that are coming into the system, and you mentioned an 81-year-old, and Councilmember Rice and I, on the point in time count, encountered an 81-year-old at the Rockville Metro Station who at 2:45 in the morning was sitting there on the concrete steps shivering and was fearful to engage with us because he did not know who we were, and he thought we were immigration or any other government agency that wasn't there to help him. Thankfully, my Chief of Staff, Valeria Carranza, was with us and spoke Portuguese to the gentleman. That is only one way in which I thank Valeria Carranza for being with me all the time. But she was able to allay any concern he had, and we immediately contacted MCCH and ordered a lift to get him to the men's shelter. And so that is why we're here. That was an especially touching moment for us, I know, literally lifting the man up the steps and putting him in the car because he couldn't do it by himself. And so all of the work that we're doing is for that 81-year-old man and everybody else in the county. And the data shows that we're doing right things, but we need to keep doing more. On that one point, as we have more seniors coming into the system, what is that continuum continuum of care, if I could use that terminology, regarding any additional services that they might need, assisted living services or round-the-clock medical care once they come in?
That's a great question. We have some answers. We don't have enough, and that certainly is something that we are going to be looking at as part of our future work. Right now, we can provide aides to come in while someone is in shelter to assist with personal care. We partner with Aging and Disability. We also have been had better luck of connecting people once they get into housing with a home health aide so that care continues. But there's going to be a greater need. Right now we are working with Aging and Disability and our partners in Behavioral Health and Crisis Services to come up with a new RFP that would address the specific needs of people that are comorbid. So they are aging, they have significant healthcare issues, they also have behavioral health issues, and maybe they're homeless, and all these other factors that complicate things. It takes a specially trained home health aide to provide that kind of care. So we hope to get that out soon. That's going to be part of it. But the other part is looking at, well, what are the different building structures that we need? When we talk about housing production, we have to keep in mind that we do have an aging population. So people that need a ADA accessible unit, those are really hard to find. So we have to make sure that we have more of those. We will be this year engaging with some of our national partners to do an analysis of our population and look at what are the specific kinds of housing units we need for people. So we'll have a better sense of what that number is and what the cost is. I don't have that today, but that is part of our future work.
Thank you for that. Last thing I'll say before I let you continue is that I appreciate Councilmember Albano's mentioning the Council of Governments meeting that we attended. We had the largest contingent at that meeting, showing that our dedication is real for all of us to go into DC to have this region-wide conversation. And to Councilmember Jawando's point in questions, on-target questions regarding some of the racial disparities, I will share with you that the data that was shared with us at this COG meeting shows that while this is a clear problem, there are other jurisdictions where that racial disparity is worse, particularly in Northern Virginia. And so part of the reason that we're going to have these continuing conversations is to figure out what some of those systemic issues are, how we limit the number of people who are experiencing homelessness across the board. But just wanted to share that data point with you. And I know we have another conversation after this, so in the time remaining, if Ms. Harris and Ms. London want to go through real quickly the strategies.
Sure.
Evan, can I just real quickly, just go back to slide one more second. Why were there no Latino? You're speaking Portuguese. What's the story with that? What's going on there?
So that is the way that we report data to HUD. So HUD looks at they look at ethnicity and race differently. So we could pull it, but it would be it's not quite so helpful. So they look at race and then they ask whether you're Hispanic or not Hispanic. That's just the way we report the data to HUD. So
this includes on the race question, any Latino that picks white or black. This would include, so they'd be embedded in.
They would be embedded,
but we can't pull them out. Well, you could because they're checking Hispanic or not Hispanic, like the census, right?
Yes.
Okay.
I
think it'd be helpful to add that to this slide so we can see that.
Sure, I'm happy to do that. I mean, what we do know is that the Latino community is actually underrepresented in the homeless continuum, which says something different about our work, and that I think that speaks to maybe a lack of people coming and accessing services or requesting services out of fear. But we will be sure to include that. Great.
Sorry, just as far, have we looked longitudinally? Has that declined, or has it consistently been around the same numbers over several years? Because there was a big change in our country a few years ago, and I'm just curious as to whether or not, that something coincided.
Yes. We have not done that, but I think it would make sense to do that.
Thank you.
We can certainly pull those numbers for you. Great. Okay. So let's go back to strategy 2. The other thing before I go through this, I just want to say on all of these, even though these strategies are not specifically spelled out as goals, they do have outcome measures. So we are still measuring, are we doing what we set out to do? So it's not that it's just some pie in the sky idea. We do actually want to have a tangible way of telling if it's making a difference. So strategy 2, you can see here, this is really looking at that length of time, the access to permanent housing, all the things that help us quantify rather homelessness as a rare, brief, and one-time occurrence in Montgomery County. Go ahead to the next slide. I won't read all these. I'm just going to highlight a few things around priority 1, the prevention and the diversion. So I think I've talked about this before, making sure that we are doing a good job targeting our prevention, being more creative about how we can adjust how we provide prevention, that maybe it's a couple months versus just one and done. You know, in an emergency, maybe we need to provide people some ongoing services. The other thing I will say around the financial literacy, we are also looking at how we can help people connect to low fee or no fee banks, because that's another issue that gets people into trouble, is that they have overdraft fees and all these other things, and then it becomes impossible to get ahead of it. Also on priority 1 is around the diversion, the shelter diversion. So on family homelessness, we started diversion in July of 2018. We've been able to successfully resolve people's housing emergency 72% of the time without a need to go into shelter. We have not done this on the single side. We feel like if we do this, we probably can expect to divert around 25 or 30% of the people. So that helps on that chart that shows the 2,200 people that would be homeless by 2023. If we can do this diversion, we can reduce that monthly inflow. And rapid rehousing, we've talked about this a lot. Right now we have a 79% success rate. We need to expand this. The thing I wanted to highlight about the rapid rehousing, so rapid rehousing is a short-term subsidy with intensive case management. Why we've been able to be successful with rapid rehousing is that people can graduate from that into the rental assistance program, or into the rent supplement program, or into a more an affordable unit. So rapid rehousing, because it is short-term, there needs to be something ongoing. We can help people increase their income, but it's unlikely that we're going to help them increase their income enough to be able to afford fair market rent. So that's a really key component, is that rental assistance program. Employment, I won't talk about that. Youth, the drop-in is very close to being open. We've already been providing some of those services, but that's another big priority. And then the last thing I will highlight here in the interest of time is just looking at those non-traditional housing options. This is really, really important. We have to look at more shared housing or more SROs, single room occupancy. This is something that has been lost. Prior to World War II, Americans, the basic housing unit was more like a bed instead of a house. Like, people had a different idea of what they needed to be able to live. And this allowed for housing for workers and to live in cities that they could actually afford to be in. It was very low cost. Over time, it fell out of fashion. It became seen as kind of poor housing where no one wanted to live. And in the 50s, New York City actually banned the production of new single-room occupancies. And so now I think that this is partly contributed to the homeless crisis, is that we don't have enough very, very, very affordable places for people to live. So as we think about production, we need to think about things like this. How can we create smaller spaces that are deeply, deeply affordable without having this idea that everybody's got to have a one bedroom and a kitchen and a living room? And how do we help create real solutions for people?
Can we get through this real quick?
Going?
Sure.
Okay,
Ms.
all
London.
right. So obviously, we end somebody's homelessness by providing them housing. And so this notion of building and supporting affordable housing solutions is really pivotal. And you heard the conversation about housing first. This is an evidence-based best practice. We need to keep doing that. We put somebody in housing to end their homelessness. But Sure, yeah. But poverty is the common denominator, so we need to continue subsidies. And Amanda just mentioned that. We need some long-term, we need some short-term. We need to provide subsidies that provide services and some without. So since I don't work for the county, I get to give you the numbers of this increased production. So we want to increase permanent supportive housing by 100 units for a cost of $2.6 million. We want to increase the rapid rehousing, which Amanda just spoke about, by 350 units for a cost of $4.2 million. But what this means is that we need your support to help landlords get engaged. We can get the subsidies, but we need to have some place to put the people. So that subsidy is useless without somewhere to rent. And also, on the next slide, the priority two, the Housing Initiative Fund, we need to realize that this can't be flat funding, that as rents go up, we're serving less people if it doesn't go up. And we need to work with retention and recruitment with landlords. Again, something we would turn to you all for. So that's housing. And I think Amanda mentioned this, but behind this strategic plan is an action plan that gives very, very specific goals, and I think you all have a copy of that. So there's a lot more information about housing in that one. You're doing the next one, right?
And again, I'll just say that there will be the piece of legislation that will be introduced, and so the headlines that you're providing with us now will have time in committee and at the full council while taking up that legislation to get deeper into it need be.
Okay, my turn. I'll go over strategy 4. So strategy 4 is about coordinating effectively across other systems of care. So we know that people experiencing homelessness have a host of other needs, including behavioral health, education, employment, healthcare, disability services, et cetera. We also know that other systems can create a pipeline to homelessness, like foster care, nursing home, hospital discharges, and obviously the jails and the prisons. So we want to make sure that we're bringing all those systems together, and we're talking about how we come up with solutions. There's a lot of detailed strategies in here. I think the thing that I want you to know and that we might need help with is around data sharing. In order for us to do this effectively, we've got to have some data sharing agreements, and those can take a very long time to process. So a little pressure from our elected officials could be beneficial for that. Support. My boss says support.
Okay, we're going to move on to strategy 5, and you all have mentioned this one as you had the affordable housing one about increasing and diversifying our funding, which is one of our long-term goals. Currently, the county provides over 70% of the funding into the homeless system. We have seen an increase in state funding, a small increase. We have some angst about seeing a decrease in federal funding. Amanda mentioned the shifting priorities around housing first and the availability of funding from the Continuum of Care from HUD. But there are opportunities. We can look at other federal sources for income. We can consider our providers becoming qualified to bill for Medicaid for certain services that they're providing. So there are other opportunities out there. But one of the most important things we really want to look at is to bring non-government resources to the table, and this includes philanthropy, obviously, but to look at sources like hospitals or businesses. Hospitals, as an example, have a vested interest in not having people return to their emergency rooms or their hospitals after surgery. And for folks who are experiencing homelessness, that return is going to be higher because they don't have some place to go and recover. And so there are hospitals across the country that have invested in permanent supportive housing so that they can send their homeless clients there to recover. And so they don't get that penalty from the federal government. So we need to look at that within our community. And there's always, I think, a business case to be made for ending homelessness. And I think that's somewhere we can look to for both support, financial support, but, looking to help us in our work to end homelessness. So one of the strategies on this slide, and you alluded to this actually, was this notion of, our first one is to bring everybody, all the players to the table so that we have a unified understanding of what the goals are and how the funding can work, so that we don't have, the organizations going to the county council, the county executive, cities, asking for things that they know will be funded rather than asking for things that are within the strategic plan. So we like the idea of bringing all those players to the table and having that conversation, and whether it means a common application or just a common understanding. And we think that's a really important idea to put forward. So that's one of the priorities for this year. And we can go on to strategy 6. And this is about educating and advocating for change. And the same way I mentioned the common funding and aligning goals, our education should be rounded in that common message. So we can use your help by pushing out information on social media. An example, Councilmember Friedson put out on social media after the community event or community kickoff. I heard from folks that actually the traffic to the website increased. And so it's really helpful when you all do that. So we invite you to do that and be part of our common messaging. And we would also like to offer that we'd be interested in any opportunities to talk if you guys do town halls or something, that this is a message that we want to bring and help and educate our community around that. That's
Mr. Reamer.
Thank you. Wanted to ask about a recommendation that you have that basically 10% of the affordable units should be provided to clients who are through the homeless services programs. Essentially, is that, and so that's, is your vision both MPDUs and if nonprofits are buying a building, that it's 10% of the building, or like talk a little bit more about what you're thinking in that recommendation?
So our idea is 10% of production at this point. So if somebody is doing a market rent building, that part, or anybody's doing affordable units that's getting money from the Housing Initiative Fund, that part of that requirement be that 10% of those units are dedicated for permanent supportive housing. So just a way to increase the units that are available for people to exit homelessness. Does that answer your question?
I think so. I mean,
just
well,
to clarify.
yes and no. You said what I said. And I'm just trying to probe a little bit further. You want to add to that, Amanda?
Sure. So one clarifying remark is it's not just for permanent supportive housing. We're asking that 10% of any new production or newly preserved units would be dedicated to people experiencing homelessness. So that doesn't necessarily mean they come with a subsidy.
Okay.
And this was done, I will also say that this was done in partnership with DHCA. They were fully aware. They probably understand more about the mechanics of how that would work than I do.
Okay, that was the key word, newly preserved. That helps me understand what the scope of what you think we need to do. So it's 10% of new production. That's, the MPDUs that go up in a building. We want 10% of those available, and then 10% of buildings that are acquired or somehow, they're under control through preservation programs. And do you have any idea where we are now? And you said you had worked with DHCA, and does that mean that this is something that they are seeking to achieve, or is this a proposal that is under consideration? Is there
I don't feel comfortable speaking for them, but they are here if you don't.
Well, why don't we ask Director to come up?
While he's coming up, can I just say it's not, nonprofits already can buy a certain percentage of MPDUs, so it's not just MPDUs, it's just any affordable housing. Is that?
Say that again?
It's not just MPDUs, it's any affordable housing production. It's not just, because nonprofits can already access the MPDUs. There are a certain percentage that are already available. So a nonprofit, a homeless provider can get, bid on
MPDUs.
MPDUs, yeah.
And you're saying, like, if MHP has a building, or if Victory Housing has a building, then there ought to be 10% available there as well.
Exactly.
That's what I'm hearing.
Yes, exactly. Yeah. Thank you.
Dr. Nigam.
Good morning. Asim Nigam, DHCA. To answer your question, Councilor Reamer, if you look at our NOFA that we have posted on our website, we are requiring certain number of units, a certain percentage of units to be at or below 50% of AMI, and within that, metrics, we're going to look at how many units will be at 30% of AMI, because the population that we're dealing with here, those population will be earning at or below 30% of AMI. So whether there is a voucher that's available through HOC or there's some other mechanism, we'll be giving preference when we're looking at the HIF funding.
Director Span, would you like to join us for a moment, please? Hang on, take it easy. Sorry, Director Nigam, can you please, so the NOFA you mentioned, that is something that was recently, we got a letter from you, I think, last week about, let's start there again. What was that?
Yes, so traditionally we have been looking at certain number of units at or below 50% of AMI. But now going forward, as we have mentioned in our NOFA on our website.
Is this for a commercial development that is seeking to have its agreement with you for MPDUs? Is that what you're referring to?
It's for HIF funding, so it's not generally for MPDUs. MPDUs go up to 65 to 70% of AMI.
Okay, this is for HIF funding.
But if there's any other project that's coming to us for preservation or new construction, and they're asking for HIF funding, we'll look at those projects, how many units are being offered at or below 50% of AMI, and within that matrix, we're going to look at how many units are going to be at or below 30% of AMI, because those people who are going to experience or at the verge of experiencing homelessness, they typically are at or below 30% of AMI. So in the end, we have to make the numbers work because our budget is limited. So the way, I have done in my prior life, serving 30% of AMI below population is through project-based vouchers.
Correct.
So that's one of the avenues. And as an incentive for the developer to get HIF funding, we have to bring all the resources to the table. So if someone is asking for pilot, we can see where the money is going if we are serving at or below 50% of AMI folks. So that will be the part of the negotiation that we'll do as we look at the new transactions.
Okay, well, I think this is something we need to, I'm going to ask Linda to further investigate. Dr. Span, is there something that you need to convey here?
First off, good morning.
Morning.
For the record, my name is Stacy Span, Executive Director of the Housing Opportunities Commission of Montgomery County. I think it's something that we have to examine more closely.
Okay.
Certainly, it's a laudable objective. It's an important objective.
Okay.
I want to point out that we have a wait list in place right now that has over 30,000 persons on it.
30,000 persons for vouchers.
30,000 persons for a voucher program that is not growing. Amanda pointed out correctly that federal resources are shrinking. You have a U.S. Department of Housing and Urban Development under this administration that is shrinking programs aggressively. And so the notion that we would claim vouchers as if they're just hanging out here, I don't have enough information to really react to, and so we weren't consulted on the NOFA. I'm not suggesting that the goal itself is not important. But when HOC does a preservation effort, when we're out here and whether we use HIF funds and then leverage those with bond funding or conventional bank financing, the numbers have to work. And so,
you're concerned that this NOFA may have affect the ability of HOC or nonprofit providers to provide housing?
I can't speak for other nonprofit providers. What I can tell you is that for HOC's part, when we're actively acquiring a property for preservation purposes, step one is directly after we figure out how we're financing it is making sure we keep those families who are at 60% or below housed. So I'm not finished yet, sir. Just give me a moment. So I think it's incredibly important to consider that the challenges here are all laudable, but I don't want to be competing with objectives around the margin so as to cause families to be further housing insecure.
So I understand what you're saying is that when the county says now you must provide a guarantee that a certain share of your units are only going to be at a rent stream that is, half of maybe or 2/3 of what it might have been before, that has an effect on your ability to get financing. Normally, we provide housing for those individuals through vouchers, I believe, and other means, but I think we should probably return to this.
So the NOFA, which is really a follow-up to the session DHCA had with affordable housing developers, which is to try to put some more transparent structure around what they're looking for in providing HIF funding, has gone out for a 30-day comment period.
Okay, so we can take that up.
For the FED committee, it'll be in your information for the Thursday CIP discussion. We'll have it in there.
Okay.
So I think there's kind of two things going on. There's this discussion of when the county puts in HIF funding for a financing package for affordable housing, are the requirements around the levels of affordability going to be different than they are now? And that's
Right.
really the issue around the NOFA. But the second piece about the 10%, I think, is a little different in that what you also heard earlier is we also just need access to units, right?
Right. Exactly.
So if you have a permanent supportive housing slot that's funded through the county, that comes with both a rent subsidy and service subsidies. But right now, there's just a problem getting a landlord, even some of our, I hate to say this, even some of our affordable housing partners, it's hard to get them to actually lease to somebody who's in the permanent supportive housing program. So this 10% doesn't necessarily mean that 10% of units all have to be funded at a level that they're always, like the rent is at
Right.
30%. What it means is we need partners.
Well-
and when we have newly preserved
HOC's
projects-
vouchers are paying market rent, actually, right?
They are.
They're, so.
But so is a permanent supportive
And so is,
housing voucher.
okay, we'll return
those
to
are-
this issue of the NOFA at FED, I
Right.
think.
But I think there's two, I just wanted to be clear, there's a couple of issues tied into this 10%, getting access to a
Right.
certain
Well,
amount.
that's why, that's actually really, that's half of what I wanted to highlight. So I think we've got some work to do there. I don't know that all of our partners are willing to accept, formerly homeless individuals. And so we need to, I think, maybe have a conversation about that, as part of this policymaking process. Okay. So just put a pin on that. I'll pass it back. But I just wanted to say the comments that were made about home sharing, I think essentially is what you were getting at. I would really like to see us develop a program around home sharing. I think we have such a large stock of single-family housing in this county, and that's not going to change. And how efficiently are we going to use it? That is a kind of a cultural issue. I think you were alluding to that. The house that I live in decades ago was occupied by boarders. Every bedroom had its own lock, and people lived in the attic and in the basement. That was normal, though, 60, 70 years ago. We could make a lot more use of our existing single-family home stock if people felt more supported and comfortable, I think, opening their home to tenants or boarders. And it's, not very many people think of that as a solution for them. But I think we've got to broach that and get some shift there because it's just, again, the overwhelming nature of our housing stock, single-family housing, is not going to change anytime soon. Why should a person be aging in a single-family house that they can barely take care of while someone else, is seeking a place to live at an affordable rate, and they're not connected. Like, they need to be connected. So I would like to return to this one as something that we could work with DHCA maybe to model a program around that in the future.
Just want to do a quick time check. We have another important conversation after this about how we prevent people from becoming homeless or experiencing homelessness through various programs. So I'll turn it over to Mr. Friedson.
Thank you for that. Thank you for the conversation and for all the commitment and the collaboration in addressing what is obviously a critical issue. I have lots of questions. I'll save most of them. I look forward to the follow-up conversation on the NOFA and on the broader questions about the HIF and HIF funding, and whether or not I continue to believe that we should actually separate out funding for homelessness and for these types of programs to put up, to highlight them and to make sure that there's more clarity and understanding and transparency of what the HIF is and what it isn't, and what the funding will be used for. But we'll save that conversation for, or continue that conversation at a future Fed committee meeting. And I have a lot of questions for the next item that we're going to talk about that are very specific. But I just have the broad question here is, what are we talking about in terms of the funding? Because here there's no numbers attached to any of this. It's 10%. And so I think it would be helpful for everybody to understand what we're talking about, because I'm not even clear, based on the way that we use the HIF and based on the way that we talk about some of these programs, of what you consider to be funding to prevent homelessness and what you don't and what we don't, and if we're all talking about the same numbers. And so, if you're prepared to answer it, I'd be very curious to know, increasing funding overall by 25%, it looks to me like the county would be on the hook for 15% of that if you're looking at getting 10% from outside sources. I'd also be interested, based on Mr. Span's comments, of how the outside funding is related to a reduced commitment from the federal government and how we make up that gap, and if that's reflected here. But what programs are we talking about in this funding? Because some of it would be capital. We've already gotten the capital budget. We couldn't come close to meeting these ambitious, bold, but achievable goals, even with the commitment that was made currently on the capital side, at least for the HIF. So I'm just curious, what we're talking about and where that money is going to come from, and is the county executive committed to putting it in? Are we offsetting it in the operating budget? What are we talking about here?
So the first thing I will say about this is an iterative process, and the number is going to change. So as we try to do things, we're able to shift our funding around. For example, if we would have mapped out how much we needed to end family homelessness back in July of 2017, before we had implemented diversion, that number would have been 3 times higher than it is today. Because we implemented this very low-cost strategy, we were able to bring that down. So I just want to be clear that as we try new things and adjust, we might be able to shift funds from one program to another. So I'll say that. The other thing I will say, when we're talking about programs here, we're talking about prevention, we are talking about rental assistance, we are talking about permanent supportive housing and rapid rehousing. We're not talking about capital cost. This is program cost, is what we're talking about. We do know
so
that
the increase is only in capital, in operating dollars is what we're talking about,
correct,
not the capital side of anything.
Correct.
Okay.
That's what we're talking about right now. I will say that we do know that there are some things that we have some dollar amounts attached. I think Sharon referenced some of them for the PSH. It's $2.6 million for the 100 units of permanent supportive housing and $4.2 million. I think that's correct for the rapid rehousing.
Can you say that again? Sorry. $2.6 million for the permanent supported?
For permanent supportive housing, 100 units, and 4.2 for the rapid rehousing. We are also, we've talked about this in previous sessions, around the increasing the subsidy amount for the rental assistance program from 200 to 400, which is far closer to 25% of fair market rent, which is what the program was originally designed to do, and that would be about $4 million. And I will hand it over to you.
Just to say that one of the things that the county executive has asked us to do is to take this look that you're talking about what it would take to address homelessness, from preventing folks from becoming homeless to getting them back into permanent housing at some point. And we're putting together recommendations for him now to take a look at a little later this week in preparation of his submission to you all. So those numbers should be forthcoming in the budget cycle.
So these goals of 15%, that part of that may be included in the budget submission, and it's all on the operating side. Am I right to expect that?
I believe that's right.
Okay.
Yep.
I did just want to say, though, on permanent supportive housing, there is a portion of that that may be Medicaid eligible also on the service side. So the total cost is about $26,000 a year, but that may be an area where there is opportunity to leverage other funds. It's a little different than rapid rehousing, which right now has generally just been funded with local, well, there are federal rapid rehousing dollars available also. We've funded local rapid rehousing slots with county dollars as well. So there are opportunities on both, depending, especially on what the federal government's interested in. They have shown some interest in rapid rehousing.
Yeah, I think that's right, Linda. I think there are always other opportunities. And we actually are able to bill Medicaid for some of the services in rapid rehousing right now. So there have been, we're always going to be looking at other opportunities to bring in funding and not just relying on local dollars. We also we're very, very close to receiving funding from Kaiser as part of our family initiative. To help us do some data analysis, to help us start a risk mitigation fund that would provide an insurance fund for landlords to get them to agree to work with us. So it's a tall order. We're asking for a lot of money, but we have to look in lots of different places to get people to buy in, because this really is it's a community issue. It's not just a government issue, and so we want other players to come to the table.
Appreciate that. Thank you.
Chairman Albanese.
I'll be quick so we can go on to the next topic. Just 2 points that haven't been discussed yet. And I want to acknowledge Beth Schuman from my office, who is our liaison to the Health and Human Services Department. She's been dealing with constituent issues this year around behavioral health. And Dr. Crowell, I know this is an issue you are quite familiar with intimately, but there have been numerous instances in which, because of a lack of beds at the state level, addressing the needs of a county resident who was in crisis and eventually will end up homeless without that particular behavioral health infrastructure in place. So it's related to this discussion and conversation to address some of the underlying needs that are leading to homelessness to begin with, is a lack of support and infrastructure at the state level to address the growing challenges we have from a behavioral health standpoint. So I just want to make that point, and in future conversations as we talk about that issue, we should bring up the homeless issue because it's relevant. And the second, quickly, is transportation. My colleague and I, Councilmember Friedson, were on the same group that was visiting during the point in time count. And transportation, obviously, we had a discussion recently on transportation equity, and there are some subtle changes that we can make. There's a ride on bus, for example, that we need to extend, and I know our friends in the Department of Transportation are not here, but there's some low-hanging fruit out there that we need to take better advantage of so that people can get to and from the various facilities we have now. So just want to bring that up as a point. And again, Ms. McMillan, as we look holistically at this issue, transportation is another component to it. Thank you.
Councilmember Rice.
I'm going to try and be really, really quick, as the lead told me I need to speed it up. So just very quickly, do we know what the recidivism rates are in terms of folks who have experienced homelessness and then we house and then come back and experience homelessness again, especially related to families? Do we know what any of those numbers are for any of our cohorts?
We do know what those numbers are.
Okay.
I do not have them in front of me. I
Okay.
believe it's around 15%
Okay.
return rate, but I would have to just confirm that.
Okay, so it'd be helpful to have that, but then also if we can try and start delineating the reasons why with that as well. I mean, and I know it's certainly nuanced depending on a person's situation. I tend to still have a feeling that I may know why in some of these cases, and so I really just want to see what the numbers and the data support. And then just very quickly, when it comes to what we were talking about in terms of overarching housing for folks, as we move into family homelessness, and this is something back with your predecessor, Dr. Kroll, in which I had talked extensively with Director Alawalia, Ms. Harris, Ms. McMillan, in terms of really focusing on this issue. The cohorts in terms of what types of housing we have available is really key. And so I think from that perspective, whatever strategy we take in terms of looking at 10% across the board. The reality is that we're going to need it in specific types of housing. And so from that perspective, we've got to be more strategic than just saying 10% across the board, because I don't need any more single-family units that aren't going to be able to house a woman and her 3 children, right? And so from that perspective, we've got to make sure that we're strategic in what it is that we need and incorporate that. So I'm not sure if you have any response to that particular.
Yes, I think I mentioned before that we will be working with our national partners to do that financial modeling and the unit production. So that is definitely part of it as well. So not just the ADA units, but how many 2-bedrooms and 3-bedroom units do we need? Because those are also 3-bedroom units are few and far between. So yes, it's an important issue.
Right, and so from that perspective, again, that's why you may be more aggressive than 10% if you don't have those types of units. And so obviously, because they don't come about that often, you may want to be more aggressive in terms of achieving that goal than you would with some of the others where they're not really going to help you in terms of offsetting the problem that you're facing. So thank you, Mr. Lee.
So real quickly, I just want to thank Ms. Harris for also referencing the drop-in center, and that is coming online. I'm having conversations. I know where it is, and fingers crossed, right, that the lease or the sale, whatever, depending on the agreement, is inked. But one last question from me. We had a hearing, HHS had a hearing approximately 2 weeks ago about the men's shelter, and we received some exciting information about how we're going to mitigate that moving forward. I wanted to see if there was an update, particularly regarding the DGS contract that needed to be signed for the vendor.
I don't have that specific update for you at this point, but I can tell you that we have been meeting with DGS, between DGS and HHS, and working on basics, and have a plan, I think, a scheduled meeting with MCCH this week to talk about that. Our timeline is still to be out of 6th Taft Court and into Crabs Branch by mid-April. So and DGS has brought off on that timeline. So I think we'll be there, and the rest of it is just us walking through week by week, issue by issue with MCCH, DGS, and us to get ready for that.
Mid-April is right around the corner, as we all know.
Believe me, I know.
Very good. Okay, so we'll continue those conversations and keep us abreast of that. So thank you all for this really important conversation. And I always love a well-choreographed committee discussion, because as we're talking about trying to limit individuals from experiencing homelessness, now this second part, and I'll hand it off to Chair Reamer about what we can do to actually prevent people from experiencing homelessness and keep them in their homes.
Thank you, Councilmember Glass. Really appreciate your taking the lead on homelessness issues for us at the council, and really it was a very encouraging presentation, and we had a lot to work on there, so we'll keep working on that. Now, we had an OLO report that was brought to us in July of 2019. Very broadly, it looked at all of the rent subsidy programs and proposed that there could be opportunities to better coordinate those programs to create a better information gathering and information, sort of an information platform for our subsidy programs. So we had left that meeting with a call for our agencies to work together to, address the recommendations. And so today we're circling back for a chance to hear about progress made. Aaron?
Yes, I'll just take 2 minutes to set the stage and then turn it over to our friends from DHHS. So as the chair mentioned, we're talking about a topic that is so related to what you just talked about, from program services to end and prevent homelessness. Now we're talking about those neighbors of ours who might be rent challenged and need financial and other assistance, rent subsidies to maintain their housing stability. So last July, Tori Hall and I produced and sent to you this report on inventory of rent subsidy programs. We had a wide-ranging discussion there, but for today's purpose of today's, just want to highlight 2 issues that we found, that the committee found particularly salient. One, in our report, we found that there were no common standards for data management across the 30-some rent subsidy programs, some of which are run by HOC, some by DHHS, some by nonprofits. that they had different groups programs kept different data sets on financial and demographic data, that the budget and accounting systems weren't able to consolidate. And why is data management important? Because the absence of that consolidated data means you can't compare programs and outcomes. I was taken by the previous conversation. There's very helpful information here on racial disparities, where there was hard data on some of those from those homelessness programs. That would be the goal, to be able to look at some of those issues in these rent subsidy programs. Because of the wide variety of programs managed by different institutions, we're not there yet, and that's why we'll identify that issue. The second issue we identified is from the point of view of our clients, of our neighbors who need these services, and that is, you heard about the coordinated entry system for the homeless program. What we found was, for these 30-so rental subsidy programs, there was no coordinated entry system, and so ease of access for these programs and to be able to match our residents with the right programs was essential. So with that conversation, if you turn to the packet to Circle 5, the chairs of the two committees sent a memo last July to HOC and DHHS and DHCA asking that they get together as an interagency group to look at integrated data management and coordinated entry. On page 6 of the memo, these were the suggested components that you thought should be in the coordinated data entry system and the data management system. And then on 6 and 7, Circle 6 and 7, are the elements of a implementation plan. And so I understand the folks to my right have gotten together and have some progress to report, and that's the purpose today. So with that, I'll turn it over to, I'm not sure who the spokesperson is going to be.
So I'm not going to be spokesperson for HHS on this. I'm going to turn this straight over to Ilana Branda from our side, from Health and Human Services.
Good morning, Alana Branda, Deputy Chief with Services to End and Prevent Homelessness. So you should have in front of you just a double-sided one-pager that kind of gives an overview of where we are. And so we have had many meetings, and so specifically around that kind of idea of common language and how are we handling data and collecting data, we are continuing to work through in all of our programs trying to come up with that shared language. So when we say subsidy, even just the word subsidy, what does that mean? When we use the word subsidy, and so coming up with that shared language and then exploring where we might have those barriers with doing that. Given some of the different funding mechanisms of the programs, the different reporting requirements that some of the individual providers have based on whether their funding is coming from HUD or from the state, and how it is actually flowing through our different organizations is going to affect some of our ability to consolidate all that information. So we are continuing to work through that. We expect to have a full kind of outline of where we have been able to make those matches and where those barriers might exist by June of this year. So just in a couple of months, we should have that. And then moving along to the idea of a coordinated entry system, I'm going to actually go backwards from the order here. So we recognize, especially from the standpoint of residents who are seeking services, that it is very challenging when there's programs in HHS, programs with HOC, the MPU program with DHCA, just general apartments that may be affordable, and how they're accessing that information and the duplicity that they might have to go through to try to access that information. So we have 3 things that we're piloting. So again, I'm just going to focus on the last bullet for a second, and then I'm going to turn it over to Stacy to backtrack to the first one. That HHS and HOC are working to make a universal application for the rental assistance program and the rent supplement program. We wanted to try to start piloting with that one, since those 2 programs have the most commonalities between them in terms of application process, information collected. And so the applicants would be able to just submit one application, where would be able to share that information, and we would be able to then match them with that program that aligns with them, responding directly to the request from the council. So our intention is to pilot with that. We anticipate to have that ready by the summer, to be able to start having that universal application ready. And I'm going to turn it over to Stacy to talk about the first one.
Well, good morning again, and for the record, my name is Stacy Spann, Executive Director of Housing Opportunities Commission of Montgomery County. this has actually been an incredibly enlightening process. I think when we had the original conversation, my comment was, yes, these programs exist. Yes, we ought to be working together to figure out a way to ensure that customers get served well and as quickly as possible. And that this is a snapshot of the entire housing continuum for citizens of Montgomery County. And to that end, for us, this work is important, but it's not without its challenges. And one of the chief challenges is that we are often jockeying for who's serving who, when, how, and so our interface is clumsy at best, right? And but for our teams, and part of my team is here right now. I know that part of HHS's team is here, and part of the DCHA team is here. But for our team's coordination and relationship with one another, there are a number of customers who frankly would not be served well. And so what you've asked us to do is formalize those connections, all right, so that customers aren't having to figure out how to navigate their challenges, and quite frankly, so that people aren't burdened with the time sink that requires. And so a few years back, we at HOC pioneered our own waitlist system, much to the chagrin of a number of folks in the housing authority community. And we did it because we recognize that customers should not have to walk in the door figuring out who to talk to. I mean, it's silly. And we also recognize that while most customers want a voucher, we don't have enough vouchers to go around. But we do have housing units, and then we have other programs. We also have the opportunity to market housing opportunities for folks. And so we built this housing path, which essentially is open 24/7. It's an open wait list, and it allows folks to sign on from an iPad, a laptop, a desktop, their mobile phone, but most importantly, it interfaces with the customer. And so in about a year, 12 months, and we could program it specific to whatever the needs are for our customers, since we recognize that we serve many of the same customers, it will reach out to you via text or email and say, hey, are you interested in the 1-bedroom or the junior bedroom or the whatever unit? We don't have a voucher for you. And in 12 months, are you still interested in these services? Would you take a look and think about which others you'd like, which you wouldn't like, and give us a little information about yourself so that we can further help you. And so we thought this would be the optimal checkpoint for developing a universal assessment, and it's in that first screen of housing path. Right, and so it's a secure database, but it really allows us to conduct these preliminary eligibility checks of both programs and opportunities, housing opportunities, directly with customers, and they're self-reporting the data, right? And so these things, unfortunately, take a great deal of time, and it takes a bit of time for folks to trust that their information is not going to be misused, and it's going to lead them to, again, a program supports or a housing opportunity or both. And so,
is this sorry to interrupt you? Basically, like a customer profile, right? Is it analogous to that, like a company seeking to know more information about a customer?
It is, and then we then take that information and match them with a voucher. But it's also an open wait list, right? So it doesn't have to be a wait list simply for a voucher. It can be a wait list for these programs, but it is that first opportunity for folks not to have to hunt down HHS's staff or hunt down HOC staff. They go right to this website.
And is it fairly easy to find if you search?
It is, but we can always make it easier to find.
Yeah. How do you find it? What would you search to find it?
You could search voucher wait list.
Voucher wait list, Montgomery County,
HOC,
housing voucher, Montgomery County, something like that.
That's right. And so, and we continue to work.
Do I dare to try to do it?
I mean, why not? Sure.
Just to comment, it's prominently displayed on the HOC website.
Yeah.
If you know to go to the HOC website for a program that.
Well,
may
that's
be
the
offered
trick,
by
if you know to go to the HHC
But for
website.
HOC,
But if you
it's
Google
very
it,
If you Google housing
If you
voucher,
go-
and it worked.
Look at that.
Excellent.
Look at that testimonial.
Bing.
It's nice when technology works. The most important part here is that it, look, while people are housing challenged, they are communicating with one another, right? And so the trick is, how do we use that platform to serve more people better, faster?
And I don't mean to keep interrupting you, but I think one of the things we might have observed last time was that that's terrific. There could be those who sign up through your website and don't realize that there may have been other lists that they should be getting on. You've made it easy to find you. How about everybody else?
And so that's the actual nexus point for our work with HHS and for these recommendations, because now you're, as elected officials, sanctioning our work together, and I'll thank.
Was it not sanctioned before, or?
I mean, look, there's a great deal of controversy, right? Because there are a number of tropes, of myths around people who are resource challenged, and the one you hear all the time is, these people don't know how to use technology.
Right.
Well, I got a lobby full of folks who are using their mobile phones.
It's one thing that's pretty universal at this point.
Right, at this point, right. And many folks don't have landlines. And so, anyway, it's an opportunity for us to interface with folks differently and get them served more quickly, even if we can't get them to a voucher. Right. And in the meantime, we learn a lot about them and are able to potentially connect them with other services. So with that, I'll shut up.
And I think I would take it a little bit deeper. Some of the conversations that we have are talking about that our, HHS programs eligibility and PDU eligibility programs, the criteria for that will be built into this universal assessment. So not only will the individual who accesses Housing Path be set, suggested, okay, you can go on our wait list for these HOC programs, but they will be directly at that point connected to, you may be eligible for some of these other subsidy programs. Here's how those are administered. Here's how those are operated. Here's where you need to go to access that. And in terms of data sharing, what we're working on is that HOC would actually, anyone who their profile pings that they might be eligible for an HHS support, we would actually get an alert and get that information, so that we would have, when the individual follows up, when they do come, we're not starting from scratch. We're starting already that, we know what you self-reported in your Housing Path assessment. We have the ability to access that information, and we can continue this conversation, and then more quickly and with ease of process for the resident, for the interested applicant, we can connect you to that subsidy that would be appropriate for you.
Are you working towards one database?
Well, so fortunately, this is not, it's proprietary, we own it, so I don't have to ask permission of some third party. And so, yeah, that's the goal, is we have a database now. It's about expanding it and making sure that we're not just generating a customer profile, but we're taking basic application information right at the beginning. So we're not wasting time with, okay, let's fill out these papers and start all over. It's, we know that you're already an HHS customer, or you are already an HOC customer, and so these are the interventions that we've already used, and so we move that along much more quickly. And
so is HHS moving to use the HOC database?
So we would actually both maintain our own, HOC would maintain Housing Path, and Yardi is their other system of record that they use in-house. HHS, we use primarily EICM is our department's database of record, and then HMIS, which is our Homeless Management Information System. We would maintain those, but our IT departments have already started the conversations and are working to how both of those programs, because they are the way that they both operate, have the ability to bilaterally export data and share it into the other databases.
To sync, basically.
Yeah. So what we're working on, we have a data sharing agreement in draft at the moment that we are working to getting that signed, so that we will be able to do that. And our IT departments are speaking through with all the various security measures and access in terms of what we have to set up, how we have to actually make it work. They are working on that plan that we hope to have then finalized by June, so that we can and the cost associated with that, so we can come back with the implementation schedule. So we would each keep our own, but they would have the ability to share. Right. We would make sure that when someone is going into those systems, they know of course, what is being done, or what may be done with their data and how it's being shared, and make sure that we can certify all the security behind that to protect their data exactly as Stacey
There's
was
a
saying.
universal, we build in a universal opt-in, but also have our entire team HIPAA trained so that we're not we're not causing unanticipated consequences.
Well, yeah. I mean, once you get, anyway, I mean, I have enough problem with my Google contacts. All right. But this will require you to have common data standards. The first point here from the OLO report was to build these common standards to be able to manage data. And so you won't be able to get where you want to go without crossing that line, right?
And I think, and as we've talked through it, the amount of data that we each have that we have discovered is tangentially supportive of our programs is immense, and the ease that it's able to hopefully bring to the resident experience, can really stretch far. And so we are looking at it, not just from a specific, how do I get someone into a rent subsidy program, but, or any applicable program, but how are we using it to just ease that resident experience and ensure that, speaking back to the first half of the conversation, that some of that prevention and how are we getting people connected, that one of the things that has happened with some individuals is they forget to update their housing path and they don't change their contact information in it. And so we would, with the data sharing agreement we're talking about, we would know anyone who's in our continuum, in our homeless continuum, who where they are on the wait list, and we can check in with them and have their case manager say, hey, you have this is the phone number you have in. Is this the correct information? Because if they're going to call you for an opportunity, we want to make sure they can actually reach you. And so it's even stuff like that we're having the conversations and making sure that we can cover in the data sharing agreement and in those data standards and that, that back and forth.
Contact information for individuals, it's changing constantly.
Yes.
All right. We have some questions. Councilmember Friedson.
Thank you. Appreciate it. I appreciate the fact that there seems to be some progress here, which is encouraging. I wasn't aware that there was much progress until just now, so that is helpful. Moving forward, it would be helpful to keep us informed, as we move forward when there is progress. I think it would save a lot of heartburn for everybody involved. But I appreciate the fact that these conversations have happened, that there is some movement on the OLO report, which I thought was terrific. The last conversation we had, which I thought was really thorough and substantive. A couple questions related to this specifically. One, on this document you shared with us today, the DHCA, DHHS document, there are a number of kind of deliverables of where the progress is related to the OLO report and related to the memo that was sent following the last hearing, which I appreciate. But it's unclear to me what they mean. So could you just, I don't know who's responsible for that, but for instance, the coordinated data entry system, the internal IT plan for development of a property listing called Marketplace. I've had conversations with DHCA on that Marketplace development starting in FY21. What does that mean? When will that be ready? When will actual clients be able to use it?
I'm Director DCA. We are working on that app as we speak, and we are doing the beta test for that app. So hopefully in the FY21, that app will be ready so that people can go in and do search for any type of rental housing in the county.
So it'll be ready in 21, or it's going to be developed in 21?
It's going
to be
slated
for development in FY21, and so it's just unclear to me what that means.
It's going to be ready for use in FY21. That's what I have. I know at this point.
All right, that's helpful because I think that's different than what it seems to say here. So I think that's helpful to know. I think it's important to know what is being developed, but I think to most people, they only care when they can use it. So that's what I'm most interested in. So I appreciate that. Is that the same for some of the other items that are on here? The universal assessment with HOC summer 2020. That's this summer.
Yes. So the universal assessment and the universal application we expect to have ready and implemented in the summer. The data sharing agreement we expect to hopefully have signed earlier than that in the spring, so that we can actually release some of the other stuff. And then the schedule for the data sharing, the cost, the timeline, and all the rollout of the security measures and everything that HOC and HHS have to do internally to make that happen. We expect that whole implementation schedule to be complete by June, and then based on that schedule, we'll be able to further update the process for actually having the data going back and forth.
Right. Is there a plan to notify us by June, before June, that those things are on track, so we don't have to have another briefing just to get an update?
Yeah, we can definitely do that.
I think that would be helpful if we could, find out that was happening, that we're still on schedule when, not general timelines, but on July the 1st, on July the 15th, whatever the date is, this is specifically when it'll be live, and here's where we can go to see that it's working. Would be helpful, I think, to me. One of the other items that was raised and has been raised is not just the communication among the different departments and agencies, which is critical. We have lots of different folks who are working on this critical work and being able to communicate, and that's what we focus most of today. But what was evident in the OLO report is it's not just amongst the departments and agencies, it's within the departments and agencies that the data is not consistent and it's collected in different ways. It means different things to different people within the same organization working on a different aspect of the same challenge, maybe even with the same people, the same clients, could be doing different things. Have we looked at that? Are we working on that with each organization, comprehensively with all the organizations? I mean, how does that layer on top of this interfacing, how do we address the intra-facing within the organizations? I don't know if maybe HOC, I see Mr. Spann.
I'm always
nodding.
ready to talk about what we're doing poorly.
Improving upon.
That's essentially what you said, right? So let's just go, all right. Look, we have an internal process, and we've essentially enhanced our training of folks. What you're pointing to is the silos within an organization. And so in order for us to, get people housed, keep them housed, and help folks reach their fullest potential, it's paramount that we focus on how we train and how we're doing it across divisions. And so we've spent in the last 2 years a great deal of time working through that, and then we're going to continue. As we get new folks, obviously, it's critical that we're continuing to train. So, for us, for the most part, there is some level of consistency, at least around what the data means. What there isn't is the same level of facility between the different divisions. And so, we have an internal process that we're working through, have launched over the last year to get us in a better place there.
Appreciate that. Is there any DHCA and DHHS, any thoughts on that within your own organization or broadly?
Sure. I think that's something that we're always working to improve on. We have been updating our contracts and our language to make it easier to understand, and that we're asking for the same things from people. We have contracts that are very old and have many amendments that they're very difficult to read at this point. So we have been working on that. And then I think I will leave it to Raymond to speak about what's happening within the larger HHS system. It is a huge organization, so hand that over to you.
So one of the things that I talked about when I first started working in this job was painless navigation inside of Health and Human Services, because getting from one side to the other can be a challenge. The EICM database is now one that we have all of our service areas putting information in. So when there's overlap between service areas, that helps us. We can see that and use that data to help speed the process up so people don't have to tell their story multiple times, obviously. The other one for us is coordination of services across populations. So when Amanda talks about seniors and homelessness, those two service areas now have to coordinate and are coordinating more tightly. We're looking at how is our funding aligned. So you talk about the rental subsidies that we have that we're talking about within the homeless population. We have other funding that we use to support our clients that might be aligned, might be better served in a more, if we put that together in a more integrated way. So we're just now starting to take some looks at those things. So it'll take some time, but that's the direction we're going in.
Appreciate that.
Sure. I particularly appreciate Ms. Harris's comment about the contracts, because it's important to note that so many of these programs are run by nonprofit organizations under contract to DHHS. And as she mentioned, many of these contracts have not been updated for a while, and the way to get to consistent definitions is through the contracting process. And just one last comment, as these committees look forward to how you're going to be overseeing this effort, the question of definitions will become particularly important when you ask what outputs do you want to see. We heard that the question from Councilmember Jawando earlier on, do we collect data that is by racial group? Does it acknowledge Latinos, not Latinos? That's a seminal question that if you have those definitions set up early on, then the outputs that this committee and the communities can look at will be there to begin with. And so it's very, very critical to get.
You only get what you ask for.
You only get what you ask for, and this is the opportunity, and I commend HOC and DHHS for the progress they've made. They're attacking that exact issue, but that issue is critical so that the whole reason why OLO brought up the data management was because of performance management, because of outcomes, because of your need to be able to direct dollars to those constituents who most need it. To do that, you have to have this consistency of data and definitions, and they've taken the first step, and going to take some more time to get there, but it's critical.
Appreciate that. Mr. Nagam, did you have from DHCA, are you doing something similar with your contracts?
Just to add a little bit, one thing that I'm putting emphasis is on the standard operating procedures. So if you're a current employee or a new employee, we can all be on the same page, how a process is done, what information to look for, who to communicate within the agency or within agencies in this case. So that's what we'll be looking at to see where we need to massage the process.
Great. And is DHCA and DHHS communicating on improvements that DHHS is making to contracts and looking at similar ways to make improvements if there's similar applicability?
So certainly we'll be.
Go ahead, Asim, please.
Certainly we'll be looking at those. We'll be looking at those opportunities. If HHS comes up with something where we can improve our contract or we can align our contract so that we can be looking at the same thing, we'll be looking at those opportunities as well.
So we are part of I think the counties and the CE's commitment to trying to figure out how we improve and streamline the contracting process in general, because that can be, as you know, cumbersome and time consuming, and sometimes asking a lot of pieces of information that we don't necessarily need, as opposed to getting to outcomes. We're at the starting stages within HHS of looking at outcomes-based contracting, performance-based contracting, and beginning to model that so that we ask for what we need to know rather than the 10,000 details that we sometimes currently ask for. That is part of, I think, a government-wide initiative that will include not only DHCA, but also include our procurement offices and Director Shetty's work. So.
Right. I just think there's a lot of analogous work that's being done, and if you could be working on it together as you look to streamline and improve, I just think that would make a lot of sense.
And
Aaron?
the challenge is even greater because it's not just these two departments. OMB, DPS have to involve. One of the things we found in our report was there are many programs that are funded through HIF where the dollars flow through DHCA, but the program implementation is through DHHS, and to be able to get those that budget data consolidated
right
to date has been a challenge.
Which is one of the things that I hope that we'll address, as was noted before in a future conversation, of figuring out whether that's the best way to handle some of those programs and whether we're doing it in the most efficient way. We alluded to it earlier, the $200 versus $400 for the rental assistance program. We were told in July that the department was looking at changing that. Obviously, there are some challenges either with funding or with the number of people you can help. When you make that change, you either need to drastically increase the funding to keep the current level of service, or you need to reduce the number of people that you're helping. That's a difficult policy and budgetary discussion and decision that has to be made. Where are we on that? We're 7 months later from that hearing.
Well, again, we're in the middle of the budget process.
Yeah,
and
sure.
there are several options that are being discussed and presented to the county executive so that he can make a decision subject to what the revenue stream looks like and what the income, all the other priorities he's got to address this year.
So we had left it as a regulatory change that we were expecting to see that was being discussed in the department. Is the budget question being asked first and the regulatory change going to come second, or is the regulatory change coming first and then the budget question is coming second? I'm just trying to learn what to expect here and what we should be looking at, or whether we should handle it on our end.
So I'm just thinking about the regulatory changes have to do with some of the language in the regulations, and those can come. That can come first.
Can come first? Will it come first? When should we expect that?
Go ahead.
Yes, part of the issue is that we have been asked by the county executive to make some changes into some of our programs around citizenship status. So we're trying to do that all in one as a collective. So originally we thought that we would be able to make the changes to the rental assistance program in just regulations, but now we actually have to change code as well. So we hope to see that coming very soon.
Okay, keep us posted on that. I think
prior to the end of this fiscal year.
I'm familiar with some of the challenges that have arisen of immigration status and whether there's eligibility for access to programs for some in our community who most need it and who are most vulnerable. And so obviously we want to make sure that we're working together to address those issues. I think there's shared commitment between the executive branch and the legislative branch to address those issues, but I think there's also an interest. We've all said jointly that we think that there should be an increase to the rental assistance program in terms of eligibility to keep up with what is needed, or else we're not really addressing the problem we're trying to solve with an amount of money that just is not in line with the current realities and the fiscal realities that families are facing in Montgomery County. So hopefully we can move forward quickly. Obviously we want to do it right, but in the meantime, we're not helping the people who need it. And so hopefully we can have some urgency there. Last point, and then I'll yield to colleagues. I'm obviously the coordinated entry system, very important. I think that's the, arguably the most important, because that's customer facing. That's, deciding who and how easily folks can access services, which is our job in government and in this work. And I'm happy about that, the progress that seems to be made on that. On the data sharing piece of it, I think that's critical as well. And I'm curious to know if any thought has been given to what the next step of that is. What are we going to be able to assess? What are we going to be able to use to actually turn that data sharing into actionable intelligence that makes us, or allows us, I should say, to make better decisions, to make better policy, to target resources more efficiently and effectively towards the folks who need support the most and in the areas that do the most good and provide the most benefit to those who need it?
Well, that's a tough question.
I try to only ask tough questions.
A softball here or there might serve us all well.
Noted.
So the challenge here is that we have, having worked in the space together and had an active sort of partnership, but informal partnership. The challenge is we suspect that we have the same customers. What we don't know is how we're serving them and how quickly. And so I understand the importance of getting to the next step, how we're going to use the data. But I think the interim step is what is the data, right? And because of our various funding sources and how disjointed they naturally are and how much they fight, what we're trying to do is formalize the partnership with the data sharing agreement and then figure out what is the actual data. So I know very well, as a consequence of my team, what our average housing choice voucher household looks like. But what I don't know is how they might be interfacing with HHS programs to support themselves, which then gives me an indication of whether or not that voucher is doing what we actually think it's doing, right? And so I really believe that that is the next step.
I would just add that to paraphrase someone, we don't necessarily know what we have in terms of data, and we don't know what we know yet. So we've got to do some digging into the collective data set once we've got it. I think of it as a way for us to get a clearer sense of who we serve and where they are, what their needs are, what the equity issues are, so that we can begin from that base to plan on how we allocate resources going forward.
Councilmember Rice.
Thank you very much. I'm going to try and be brief. So I'm putting on my computer science hat for a moment here, because from the perspective of what we were just challenged with in terms of looking up, I just did some general typing into Google because I just wanted to see. And the first thing I typed in was, I need housing in Montgomery County, Maryland. Mr. Span, you'll be happy to know you were the first one that came up in the system. Housing Unlimited was third. DHCA much further down the list, and some of our other partners. And it's something where I think that we need to, in this technology age, be very serious about what it is that our folks are looking for and what they're typing in. Of course, when I type in homelessness, Susie Sinclair Smith will be happy to know MCCH certainly tops the list there. There are some other things that I typed in as well, how to get subsidized housing in Montgomery County. Again, HOC tops the list. But then when we get to those particulars in terms of what it is that we're looking for and what they need, those need to be there and be clicked upon, because that's the other piece of this that makes it easy for our clients to assess. So behind the scenes, absolutely, we need to have that coordination. But the reality is, if I can't find it to begin with, it really doesn't matter, and I'm going to get frustrated and go off and do something else or talk to whomever. And who it also makes it easier for is our partners. So when a person shows up at Manna and they're asking for food, and a person says, do you have the stable housing that you need? And we're training them now to ask those questions. Those are the things that, in partnership, the very laudable things that you guys are doing in terms of an interfaith works and saying, are you stable, and all these other kinds of things. But again, if I then get confused when I go and start looking for and researching, or I have a pamphlet with 8 million things of who I can call, which one do I call first, and which one is going to be best based on my situation, right? An analysis based on a certain number of simple questions at that intake. And so I just want to give you feedback. And again, this is not going to be something that happens overnight, but something that when we look at how other people are designing apps and programs, and they're using that basic information to then shape what the experience is going to be for the customer, we need to be doing the same thing for our clients. And making sure that we make it easier for them, because it helps us. Because if we also understand, as we filled out the point-in-time survey and a person has encountered mental illness, or have you ever been diagnosed with a mental illness, well, that's something that we really need to know, because that's going to help us in ensuring that whatever services we provide for permanent supportive housing, we need to make sure that that mental health piece is a key, strong component of that, or else we're going to lose them again. Right? And so we know that that's more important than for the person, and it still can be a part of, and you want to do daily checks and make sure that people are fine, but intensive work versus a bit of hand-holding is very different. And as we lose people, the 15% that you talked about, right, and that's what we can trace and what we're tracking. I'm sure it probably may be a little bit larger than that in reality. Those are the kinds of things that I think about how we can do our jobs better and make sure that we utilize this coordination to the best of our ability. It's great to coordinate and all those kinds of things and have it all connected, but if in reality we're not using the right information and getting folks the data that they need, it still isn't helping the situation. So I just wanted to put that out there as a suggestion in things that we think about in terms of how to frame and shape this, because I think it will be incredibly transformative and helpful for us in the future. So thank you guys for your great work and your coordination. We've made great strides. So please don't take this suggestion as diminishing the great work that's being done, but there's still some more things that I think we need to do to make it even better. So thank you.
Thank you. All right. Aaron, do you feel like we've addressed the, okay?
I'll be with the chairs about when you want to follow
Yeah,
up
I
on
was
this
going to say,
again.
I'd like to follow back up. So what is the timeline on the completion of the integration so that the two systems can talk to one another?
The actual integration, yeah, so undetermined. I mean, the truth is we'll know more in terms of cost and coordination by June
Okay, so you're
timeframe.
scoping out what
We
it will
are.
take to
Yeah.
create that syncing. You
Because we have
haven't,
independent architecture already.
Right.
And so now, how do we actually get it to not just talk, but reliably work with one another as updates and other things happen? So,
Okay. Well, when can I hear a report? What's a realistic timeline here?
I think Councilmember Friedson's dates about coming back late May to early mid-June, we will have updates by that point around that implementation schedule for the data sharing. We should have an update then on the agreement, and we should be able to provide an update at that point in terms of are we on track for the universal assessment and application in addition to the common language. So I would stick
Okay.
with that if
Let's
that
go
works
for
for you
that.
guys.
I
So,
would
like,
say probably early
after
June,
budget,
we
yeah.
usually break late May after the budget, but we're back in June, so
We'll schedule something in the June timeframe for an update.
let's say first week of June, that would be
Okay.
not end of June, because things get going.
Okay. And I would suggest that in addition to updating the timeline on the data sharing and the coordinated entry, if they are able to discuss, to Mr. Friedson's points, some of the input challenges, the data that they have, and the outputs, how they see this data being used to forward the mission would be helpful. The one other issue that was in the chair's letter that hasn't been addressed today is the issue of governance. They've been working well together, sort of on an ad hoc, but as things go on, similar to the ICH on the homelessness, who's going to manage, who's going to be in charge, how are they going to coordinate over time? I think that would also be helpful to start the conversation when we meet in the summer.
Yeah, I mean, there's an underlying question here of why are you trying to sync your databases rather than just use HOCs, but I'm not going to ask that question today. I imagine you've already considered that and you've reached that conclusion. But, okay, good points, so we'll get back to that as well. All right, thank you very much for the dialogue today. Appreciate your working on this and look forward to the next steps. Adjourned.